moving forward, as we think about the utility of an all-payer claims database, we move to what we call payers. Now, the reality is that all people who have insurance are, as individuals, payers, because we pay into that to a certain amount. And then you have large entities like Medicare and Medicaid who are payers. But the reality in today's world is that if we look at all the people who are covered by insurance, somewhere around 60% of that runs through and is covered by employers. So employers represent a key and very important stakeholder in this equation. And so we're very pleased to have with us today Jenny Goins. Jenny is the president and CEO of the Kentuckiana Health Collaborative, which is an employer-led multi-health care stakeholder coalition. And the Kentuckiana Health Collaborative's vision is a more equitable system for health where all people in Kentucky and southern Indiana have access to high quality and affordable health care. So welcome, Jenny, and we look forward to hearing about employers and the benefits they can reap.
Thank you, John. I'm very excited to be here. You can go ahead and go to the next slide, please. When you think about employers, we don't tend to think about the fact that employers pay a large chunk of healthcare in the United States. And I will show some slides about that. But what has been talked about already is this concept of comprehensive data. When I was involved and ran the Kentucky Employees Health Plan, the largest self-insured plan in Kentucky, we would always look at our benefits from two areas: fiduciary responsibility and member responsibility. And it's really hard as you're looking at data across Kentucky, and you've heard from the prior presenters about the health of our state, about how the APCDs can really pull all that data together. When you don't have data in one spot, it makes it more challenging for employers to really understand that. And so the Kentuckiana Health Collaborative, I do want to say this: some people have referred to us as a mini APCD because we do get voluntary claims data from payers, and we take that information and we work with a data analytics group and we crunch out provider data related to things like testing A1C, how are we doing on colonoscopies, breast cancer, pediatrician visits, and those multiple things in that area. And we send that to providers so that they can look at their own data and see how they're doing compared to other providers within the state and benchmarked across the state and across the nation. And then we also do community reports. The provider reports are for the providers only. We don't publicize that data, but then we do community reports where we do pull that information together in a bigger scale. But that's a very small component of what you've heard about already. So that hence the kind of referring to a mini APCD. Having all of this information together in one place, as you can see on the slide here, really helps employers and coalitions benchmark cost, preventive service measures, and high cost cases. There's so many nuances to health insurance. You can't just look at, well, what are my medical costs? What are my pharmacy costs? And you do all that in silos. It needs to be pulled together. And which of my members are able to access care, which are not able to access care. And so taking that information really does assist with benefit planning and design. We really need to be able, as employers, purchasers of healthcare, figure out how do we improve or continue to have healthy employees while we're controlling cost. And I'll show you some slides that talk about how costs have risen. And now the federal government is stepping in and requiring employers to pay a fair price for health benefits. How are they supposed to know that they're paying a fair price when they don't have the data to really look at that? And again, it's not all about price. It is about controlling cost, but also making the population healthy. Next slide, please. And you can see on this slide taken from the Health Systems Tracker at KFF that Medicare and Medicaid have been increasing the cost, the spending for that. Private insurance carriers are paying more of that cost by quite a degree. So the spending per employee by private insurance has grown dramatically compared to Medicare and Medicaid. And again, we don't have a good way, as it's been mentioned, of looking at all of this different detail in one place. Even researching for this presentation, I had to go to multiple places to find the information that I was looking for. Next slide, please. So one of the things that, you tend to think, well, costs are going up, so that must mean people are going to the doctor more. And you do want people to go to the doctor at the right time, in the right place, etc. But when you look at the data, when we're looking at spending, utilization, price, and GDP per capita, you can see that utilization is not driving the cost of coverage. Kentucky saw an increase of 5.3% in utilization between 2014 and 2018. And so as an employer, you're thinking utilization, that's good. Again, if they're utilizing their benefits the way they should. But 5.3 does not compare to the high price above 10% of what's happening in the price, in the spending above 15%. Next slide, please. And then on top of that, not only are the prices going up, family premiums, and this is focused on family premiums are going up significantly compared, and this is across the country, compared to employee earnings. So inflation is at 60%, earnings at 90 have gone up 90%. Family premiums for healthcare have gone up 284%. And so as employers, what we're trying to do is figure out, again, how do you keep those family premiums and single premiums? What are the things that you can do while making sure that people have access to healthcare, making sure that they can afford healthcare? Because if people don't go to the doctor, then that means they will end up most likely having care that will be more expensive down the road. Preventive screenings, those kinds of things, yes, we pay for it 100%. But what if they put off just going in for, they have symptoms and they need to go in and see the doctor, and they put that off because they have a high deductible plan or any of those kinds of things? It's going to cost the employer more later. And again, while the employer is not totally focused on cost, it takes cost and care for those members together to really pay attention to what's happening. Next slide, please. And then in Kentucky, when we look at family premiums, again, we're just focused on family premiums, that tends to be more expensive, is we paid in 2021, the total annual premium for families was $21,531. And you might say, well, that's not much higher than what others are paying in the States. But I can tell you, as at one time a single mom trying to cover the cost of healthcare, I understand that $20, $25 difference makes an impact on whether you go to the doctor or whether you can afford those family premiums. And again, you saw the slide where the premiums for families and singles, but those premiums are increasing at a rate higher than the paychecks are increasing. So next slide, please. So why are APCDs, all payer claims databases, so important for the employers? Again, employers pay, John mentioned this number, 60% of healthcare costs or premiums, and all of the costs are paid by employers. As someone who's led both fully insured and self-insured plans, I can tell you that having access to this data helps make decisions about, again, cost and health. And it doesn't mean that you have to get down to the individual provider. There will be safeguards for that, as have been mentioned by Chris and Jeff. But we need to be able to understand holistically what is happening in our state, what is happening within regions of our state, what's happening in the large cities within our state. Because as an employer, if you're paying, and you will be paying for that health care, it's almost treated unlike any other commodity, if you will, in a line of business. Healthcare is a very high cost for employers, and for employers to continue offering healthcare benefits, having to go to multiple websites to find out information, or even to pull in information from their own carrier for medical, for pharmacy, for wellness, for on-site clinics. There are all these partners that work together to be able to go to one location that helps tell the story of the community that the employer is in, or the region that that employer is in, is very important, because one access point helps us understand quality, which is so important. And there has not yet been proven a relationship or a correlation between cost and quality. They're different. And you may have a high quality provider, whether that's at the hospital or an individual provider or a surgery center. And that high quality provider could be a high cost provider or a low cost provider. There's no correlation. But we do need to, as employers, understand where should we be sending our employees to for high quality providers. But then also the affordability of that. Where are the places where we need to be sending people and encouraging people to go? Not saying you can't go somewhere else, but encouraging, or maybe having a center of excellence, which is a benefit design option, where it is more affordable and you get the quality. But we also have to look at equity in healthcare. It's amazing that we don't have true equity in healthcare. And you can break that down, whether it's in from a racist or racism point of view, and no one may be being biased or racist on purpose, but the system itself has been shown. One of the positives of COVID-19 is the data is telling us, if you're a person of color, you're having a different experience than someone who looks like me. And so that equity in healthcare from that people of color has an issue. And then also, what about social determinants of health? Can people afford? Do they have access to transportation, etc.? And so it may not be that the employer needs to solve all these, but the employer needs to have a role in understanding, so that they can look at their benefit design and try to figure out, do we offer telehealth in a particular area? So just some examples of saying, how could we use this all payer claims database to make sure that we have affordable, equitable, and quality care for the people who work with us? Because again, employers are wanting to go back, and it's natural for all of us who run a business. You're going to go back to that bottom line, and you need to be able to have healthy people working, and you need to be able to afford to give them healthcare benefits. But one of the big things, and one of the things that I'm very passionate about with the Kentuckiana Health Collaborative, is the APCD gives us that opportunity for collaborative discussions, just like was talked about with research. Policy making. Employers are always paying attention to policy making and what the legislative body is doing, and helping the legislators understand, that give and take. If you put a bill here, let's say it's about pharmacy benefits, how does it impact over here on the employer or maybe the member? So there's always this give and take. And so the collaborative nature that allows a discussion that brings in employers, providers, payers, patients, all of us together to really look at this healthcare system, to look and understand utilization, work through barriers to access, and make sure that we have effective and efficient benefit designs that enable people to be able to afford to use their healthcare benefits that the employer is providing. And we all know that we have employees in Kentucky who have employer provided insurance, but they can't afford it. So they end up on Medicare, Medicaid. So those are really the key reasons why an all payer claims database can help employers. I know there are many more, but trying to just pull it down to a handful for this presentation. So very open to discussion about this, but the Kentuckiana Health Collaborative and the employers we have are as members and who we represent are very open and positive about what an APCD can do for the state and for the employers in the state.